Dear students, today we are going to study the next part of the sulfonamides, that is folate reductase inhibitor. The first drug, it is the trimethoprim. The trimethoprim is 5-3,4,5 trimethoxyphenyl methyl 2,4 pyrimidine diamine or 2,4-diamino 5,3,4,5 trimethoxybenzyl pyrimidine. It is closely related to the several antimalarials but does not have good antimalarial activity by itself. It is, however, a potent antibacterial agent. Originally, it was introduced in a combination with the sulfamethoxazole. It is now available as a single agent. It was approved by the FDA in 1980. It is a single agent is used only for the treatment of uncomplicated urinary tract infection. The concern is that when it is used as a single agent, bacteria now susceptible to trimethoprim will rapidly develop resistance. In combination with sulfonamide, however, the bacteria will be less likely to do so. That is, they will not survive long enough to easily develop resistance to both drugs. It is given in combination with sulfamethoxazole, which shows the synergetic action. This combination is commonly used for antibacterial action, which is called as cotrimoxazole, which is used in the proportion 5:1. Now we will study the synthesis of trimethoprim. The synthesis of trimethoprim is carried out with starting material 3, 4, 5. You can see this is the first position, second and third, 3, 4, 5 trimethoxybenzaldehyde. When this molecule undergoes the reduction to produce 3,4,5 trimethoxybenzyl alcohol, only the first position, that aldehyde, get converted into alcohol. Then this molecule undergoes the chlorination in presence of thionyl chloride to produce chloroethyl 1,2,3 trimethoxybenzene. This chloroethyl 1,2,3 trimethoxybenzene, when treated with cyanoethyl acetate, it will give intermediate. This intermediate, when treated with ethyl format, it will form the next compound which undergoes the cyclization in presence of guanidine, and this guanidine derivative then, or this cyclized compound, then treated with POCl3 to give the trimethoprim. The next part we have to study, it is the sulphones. The sulphones are primarily of interest as an antibacterial agents, though there are some reports of their use in the treatment of malaria and rickettsial infection. They are less effective than the sulfonamides. Para-aminobenzoic acid, that is the PABA, particularly antagonizes the action of many of the sulphones, suggesting that the mechanism of action is similar to that of the sulfonamides. Further, infection that arises in patients being treated with sulphones are cross-resistant to the sulfonamides. Several sulphones have proved useful in the treatment of leprosy, but among them only dapsone is clinically used. It has been estimated that there are about 11 million cases of leprosy in the world, of which about 60% are in Asia. The first report of the dapsone resistance promoted the use of multi-drug therapy with dapsone, rifampin, and the clofazimine combination in some geographic areas. The search of antileprotic drugs has been hampered by the inability to cultivate M. leprae in artificial media and by the lack of experimental animals susceptible to human leprosy. A method of isolating and growing Mycobacterium leprae in the food pads of mice and in the armadillos has been reported and has permitted a much wider range of research. Sulphones were introduced in the treatment of leprosy after it was found that sodium glucosulphones was effective in experimental tuberculosis in guinea pigs. The parent sulphone, that is dapsone, is the prototype for various analogues that have been widely studied. For variation on these structures have given active compounds. First one, substitution on both 4 and 4 amino functions. Then monosubstitution on only one of the amino function. Then nuclear substitution on one of the benzenoid ring and the replacement of one of the phenyl ring with a heterocyclic ring. The antibacterial activity and the toxicity of the disubstituted sulfones are thought to be chiefly caused by the formation in vivo of dopsine. Hydrolysis of disubstituted derivatives to the parent sulfone apparently occurs readily in the acid medium of the stomach, but only to a very limited extent following parenteral administration. Monosubstituted and nuclear substituted derivatives are believed to act as entire molecule. Now we are going to study the drug, that is the dapsone. Dapsone, it is the 4,4-sulfonyl bisbenzene amine 4,4-sulfonyl dianiline or para-diamino diphenyl sulfone or DDS, occurs as an odorless white crystalline powder which is slightly soluble in water and sparingly soluble in alcohol. The pure compound is light stable, but the traces of impurities, including water, make it photosensitive and thus susceptible to the discoloration in light. Although no chemical change is detectable following discoloration, the drug should be protected from light. Dapsone is used in the treatment of both lepromatous and tuberculoid type of leprosy. It is used widely for all forms of leprosy, often in combination with clofazimine and the rifampin. Initial treatment often includes rifampin with dapsone followed by the dapsone alone. Dapsone is used to prevent occurrence of multibacillary leprosy when given prophylactically. It is also a drug of choice for dermatitis herpetiformis and sometimes used with pyrimethamine for the treatment of malaria and with the trimethoprim for the PCV. Serious side effects can include hemolytic anemia, methemoglobinemia, and the toxic hepatic effects. Hemolytic effects can be pronounced in patients with the glucose 6-phosphate dehydrogenase deficiency. During the therapy, all patients required frequent blood count. Now we are going to study the synthesis of dapsone. The synthesis of dapsone is carried out with the starting material 1-chloro-4-nitrobenzene with sodium sulfide. The two molecules of 1-chloro-4-nitrobenzene reacted with sodium sulfide. The condensation type of reaction takes place to give an intermediate. This intermediate then undergoes the oxidation reaction in presence of formic acid and further followed by the reduction in presence of tin HCl to give a dapsone molecule. Thank you very much.